When it comes to skilled therapy, it's important to see the right person, and it can be very easy mixing up primary roles. There are great practitioners in both physical therapy and occupational therapy, but one might be slightly more suited for your particular ailment. So should you see a physical therapist or an occupational therapist? By the end of this video, you'll know the distinct differences between the two and which one is best for you.
Hi, my name is James Ingram. I'm a treating physical therapist at EW Motion Therapy, and I've been treating for about 2 years now. We see a wide variety of issues in the clinic. We can see orthopedic issues, neurological issues, balance issues. There's a wide range from young and old. Today, I want to talk to you a little more about the differences and similarities between physical therapy and occupational therapy, so that way you can be a little more informed and make the choice that's right for you. There are a lot of similarities between physical therapy and occupational therapy. At the end of the day, we're always addressing patient movement deficits and movement needs to try to get you back to living your life. When it comes to schooling, both physical therapy and occupational therapy are doctorate programs now. During the course of the program, you accrue a certain number of clinical hours, and then once you receive your degree, you have to sit for a national licensing exam, and then you have to be licensed in the specific state that you practice in. In many rehab settings, a physical therapist and an occupational therapist will see the same patient in the same day. For example, if somebody had a stroke, the physical therapist will help teach the patient how to walk again. For example, you may be walking over to the bathroom, and then once you're there, the occupational therapist will help show you how to brush your teeth again. Physical therapists and occupational therapists, at the end of the day, we're both going to be hands-on in trying to address strength and range of motion deficits to try to get you moving again. Both therapists are going to be hands-on. There's going to be a lot of overlap between the two, and so we're really working towards a common goal. So we've discussed some of the similarities between PT and OT, but now let's look at some of the differences. One of the main differences between physical therapy and occupational therapy is a physical therapist will mostly look at gross motor skills, whereas an occupational therapist is going to look at fine motor skills. What that means is a physical therapist is going to be the one that helps you walk, helps you run, helps you lift items, whereas an occupational therapist is going to focus on fine motor skills. Those, when we're talking about fine motor skills, we're looking at brushing your teeth, buttoning the buttons on your shirt, holding a pen to write with. Those are more fine motor skills, and that falls more into the realm of occupational therapy. To get a little more specific in the differences between physical and occupational therapy, a physical therapist is going to treat the whole body from head to toe, because we view the body as one big mechanical chain. So what can happen if we look at, say, a baseball player that's retraining his arm how to throw? So a physical therapist will look at the whole body, starting from the legs all the way up through the trunk, work on trunk mobility, and then we'll eventually work our way through the arm all the way up through the hand. An occupational therapist is typically going to work more just on the upper extremity. This isn't in all cases, because occupational therapists can work on the whole body as well. It's just typically we see occupational therapy work more on the shoulder, the elbow, the wrist, the hand. That's kind of more the occupational therapist's specialty, if you will. When it comes to choosing between physical therapy or occupational therapy, you can talk to a physical therapist or an occupational therapist. If you have questions, they will be happy to answer them, and they can certainly point you in the right direction to get the help that you need.
Whether you choose physical therapy or occupational therapy truly depends on your case. If you think physical therapy is right for you and you would like to learn more, click the link in our description below to watch our video on what is physical therapy. This video details exactly what physical therapy is and whether it's the right fit for you. If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.